Hello everyone, my name is Rebecca Avithia. Today we're going to be talking about diabetes and insulin since you guys are level 1 students in your med-surg and pharmacology classes. The objectives of this presentation are going to be that you'll be able to identify 3 characteristics about each type of diabetes, type 1 and type 2, recognize 3 adverse effects of insulin administration, and be able to compare and contrast the time of onset, peak, and duration of rapid-acting, short-acting, intermediate-acting, and long-acting insulin preparations. When we're talking about the normal pathophysiology of the body, normally our beta cells are constantly secreting a small basal amount of insulin. And then after about 2 minutes of eating, there's an increase in circulating glucose from the food that results in an increase in insulin secretion. This usually lasts for about 15 minutes, and then it's followed by a postprandial secretion of insulin. In type 1 diabetes, this is caused by an autoimmune destruction of beta cells that leads to an insulin deficiency. This autoimmune response can actually be caused by viruses or other environmental toxins. It also consists of macrophages and T lymphocytes that attack our beta cells. And then this results in the beta cells' inability to secrete a basal insulin or respond to an increase in the circulating glucose from eating. Type 1 diabetes usually occurs in childhood. Nutritional status at that time, the patients are commonly undernourished. The genetic predisposition is moderate, and initial symptoms usually include hyperglycemia, polyuria, polydipsia, polyphagia, weight loss, and lethargy. Type 2 diabetes is caused by insulin resistance due to excessive glucose production, decreased skeletal muscle uptake of glucose, and increased lipolysis and free fatty acid production. Beta cell function is reduced and steadily decreases, therefore they're unable to secrete insulin that is sufficient enough for the increasing glucose levels that occurs with eating. This is usually caused by a genetic predisposition and obesity rather than an autoimmune response like in type 1 diabetes. The age of onset is usually over 35 years old, however, can occur at a younger age. Nutritional status at the time, patients are commonly obese, and the genetic predisposition is very strong. Patients are often asymptomatic, however, they can present with hyperglycemia, lethargy, polyuria, nocturia, and polydipsia. Our goals of treatment for patients with diabetes is to keep blood glucose levels in a fasting range between 80 and 130 and postprandial less than 180. Insulin is a medication that we can use to help treat those with diabetes for type 1 and then for some patients with type 2 who are unable to respond to oral medications. Insulin is a polypeptide hormone that cannot be broken down in the GI tract. Therefore, we give it by subcutaneous injection, by IV, can even be given through inhalation or by insulin infusion pump that is subcutaneously, is also subcutaneously. The goal is to control hyperglycemia, avoid ketoacidosis, and maintain hemoglobin A1C levels within normal limits or at controlled levels. Adverse effects can include hypoglycemia, weight gain, local injection site reactions, and lipodystrophy. With lipodystrophy, you don't want to inject insulin into these areas because insulin absorption can vary. And then with hypoglycemia, with that, you're looking for headaches, anxiety, tachycardia, confusion, vertigo, diaphoresis, shakiness, increased appetite, blurred vision, and weakness and fatigue. Rapid-acting insulin, you have insulin Lispro or Humalog and insulin Aspart or Novolog. Their onset is between 15 to 30 minutes, therefore we give this one within 5 minutes of the patient eating. It peaks within 1 to 2 hours, and it lasts a total of 3 to 5 hours. Actually, inhaled insulin is considered to be a rapid-acting insulin. For short-acting insulin, we have regular insulin, or Humulin R, or Novolin R. It has an onset of 30 minutes to 1 hour, peaks in 2 to 3 hours, and lasts about 4 to 6 hours. Regular insulin is the only insulin that we should be giving through the IV whenever we have someone come in for a hypoglycemic emergency like DKA. Intermediate acting insulin is our NPH, Humulin N or Novolin N. It has an onset of 2 to 4 hours, peaks in 4 to 8, and lasts about 8 to 12 hours. NPH is actually created by adding protamine and zinc to regular insulin. The protamine makes it less soluble, which makes it slower to absorb. Then we have our long-acting insulins, our Levemir and Lantus. These have an onset about 2 hours. They don't really have a peak, and they last about 24 hours. Insulin glargine, it forms a precipitate at the injection site that allows it to slowly release insulin over an extended period of time. And then insulin detamir, it has a fatty acid side chain that enhances its association to albumin. So this disassociation from albumin results in its long-acting properties. So now we're going to do a quiz to test your knowledge about insulin and its effects. Question 1. Which insulin has an onset of 15 to 30 minutes? Regular insulin, insulin Lispro, NPH, or insulin detamir? The answer is B, insulin Lispro. Which insulin can be administered intravenously? NPH, insulin aspart, insulin Lispro, or regular insulin? D, regular insulin. True or false? A patient just diagnosed with type 1 diabetes is likely to be obese. This is false. A patient who is diagnosed with type 1 diabetes is likely to be undernourished. True or false? The onset of type 2 diabetes is usually in adulthood, while type 1 is in childhood. And this is true. Insulin administration can have adverse effects such as weight loss, hyperglycemia, hypoglycemia, or vomiting. Answer is C, hypoglycemia. Type 2 diabetes can be caused by all of the following except autoimmune responses, obesity, genetics, or aging. And the answer is A, type 1 is caused by autoimmune responses. True or false? It is acceptable to inject insulin into areas of lipodystrophy. This is false because absorption of insulin can vary. True or false? Inhaled insulin is rapid acting. And this is true. So now I want you guys to draw a graph such as this one, or that looks kind of like this one, that displays the onset, peak, and duration of the following insulins. Insulin Lispro, which will be the rapid acting, regular insulin, NPH, and insulin glargine. Thank you guys for watching and participating.